Senator Klobuchar.
Thank you very much, Mr. Chairman. Thank you for holding this important hearing. And Senator Lee, thank you for your work on this bill. I know I've been at meetings with you and Senator Durbin, Senator Booker, through various administrations where you helped to get the First Step Act passed, and I want to thank you for that. And I guess I'll start with that. I know you've had a few questions about this, Director Carvajal, and but, you know, you talked about what you're doing to implement that bill. And I've done a lot of work with drug treatment programs. We have a lot of good treatment programs in my state. And according to the independent review committee that was actually established as part of the First Step Act, BOP has not taken sufficient steps, including prior to the pandemic. So I understand the problems with the pandemic, everyone does, but to provide sufficient access to programming. Do you agree with the assessment? Do you think there was something wrong with the assessment?
Yes, I do, Senator. I can't speak for anything that happened before. I wasn't in the process or delivering, but from my time forward, I assumed this position about a month before COVID hit. So I would have to defer or follow up prior to that. But I will tell you that even through COVID, we had over 25,000 inmates complete a program for time credits. The IRC works with us. I'm familiar with the report and the recommendations they made. But we worked with them to do this. We've expanded our programs. We had over 41,000 inmates participate in drug treatment or education last year of some type in the Bureau of Prisons. So I'm not sure what it is that we haven't provided. I would need some specifics.
Okay, well, I think it's in the report that they talked about that there wasn't sufficient access.
They talked about capacity. We've expanded capacity.
Okay.
As I stated, over 41,000 inmates participated in a drug treatment or education program last year, even through COVID.
So what you're saying is you acted on those assessments?
Yes, from the time I've been in here, we are taking action to meet the First Step Act.
Okay, let's go to the focus today on the pandemic and what's happened there. The fight against the pandemic, as we know, continues to put more incarcerated people at risk. The BOP announced the deaths of 8 more incarcerated people in March and April of 2021. In addition to the vaccine, of course, testing is one of the best ways to control the spread of the virus, but according to a report by the Pandemic Response Accountability Committee, BOP only tested 30% of the inmate population between February and August of 2020. Since August 2020, has the percentage of people in BOP facilities who have been tested increased, and do you have that number?
Senator, I know that we have conducted over 500,000 tests in the Bureau of Prisons of over 150,000 inmates at least. So that may include testing some twice, things like that. I follow the guidance of the CDC and my experts, my medical director. Early on, it's probably accurate. Testing resources were not available, Senator. We would have been applying.
I understand. Well, they're more available now, but I just want to look at the percentage, and it's okay if you don't have that. If you could give it to me later, that would be great, to go from the 30% to where you are since August 2020. Last June, I asked about testing of asymptomatic inmates, which BOP said it was doing in consultation with CDC guidelines. Do you know what percentage, again, you can put it in writing later, what percentage of BOP tests have been administered to asymptomatic inmates?
I don't know the number of percentage, Senator, but our strategy with the testing is in lockstep with CDC and correctional systems. Now, I know that has changed recently, and we're working on that now. My medical director is actually working on a plan going forward of how we would apply testing if the guidance changes. But we've been following the guidance. At one point, asymptomatic testing in our environment was not recommended because it wasn't a good use of resources.
Yeah, I remember. I know this way back when my husband had COVID and I didn't get a test. But, you know, things have changed over time because that was over a year ago. So you testified today when Senator Durbin was asking questions that while all BOP staff have been offered the vaccine, only 51% of staff have been vaccinated. Is that right?
Yes, ma'am, it's about 51%.
Okay, why do you think that half of BOP have accepted the vaccine when offered and that half have not? What steps are you taking to combat the vaccine hesitancy?
Well, Senator, we have done a campaign effort, obviously encouraging it. Normally, as a leader, I don't do anything before my staff other than when I want to show them by example. This is one of those cases where I myself was vaccinated to encourage others that it was safe. I've done videos. We collaborated with the national union at the local level and the national level to encourage our staff to be vaccinated. It's a personal choice. We respect that. We don't mandate it. But it is in line with firefighters, police, critical infrastructure. I've seen everything.
No, I know, but it's just 95% of Mayo Clinic doctors have been vaccinated because they don't want to give it to their patients. And I keep thinking of the inmates that are there that, obviously incarcerated, but they can't choose whether or not the people that are close to them have decided to have the vaccination. So I guess that's something for us to deal with on another day. But that, to me, you have literally people who are incarcerated, and then you have people that have chosen not to get the vaccine. And then I look at the Mayo Clinic numbers are 95%. And so the people that go to Mayo Clinic, a place I'm very proud of in my state, those patients don't have that same risk as the people that are incarcerated. So my last question is about the last May, I sent you a letter expressing concern about how the BOP is assessing eligibility for home confinement, particularly after we learned about Andrea Circlebear, who died in federal custody 4 weeks after giving birth while on a ventilator and after testing positive for the coronavirus. We know that weeks later, Paul Manafort and Michael Cohen were transferred to home confinement. I still don't have the data that I think I need to release information on how cases are prioritized and the demographic data of the people who were transferred. Can we get that? I mean, what percentage of transfers were denied because of an inmate's pattern score? The BOP's risk assessment tool, which Senator Booker mentioned, numerous civil rights and legal organizations have warned is likely to perpetuate racial disparity in decision-making. Can we get those percentage releases so we could look at them?
Yes, Senator, I will speak with my staff and follow up on that. I'd like to since you mentioned the pattern score, we have recently expanded the criteria working with the department. We have now given the authority to consider low pattern scores going forward, where before it was a minimum pattern score was the criteria. Working with the Department of Justice, we have increased that to consider low pattern scores now. So we are working to get as many people appropriately out, again, within the criteria we're given, Senator.
All right. Thank you.
Senator Cruz.
Thank you, Mr. Chairman.